Hi, I'm Dr. Surekha Tiwari. I'm a practicing homeopathic doctor in Bangalore for the last 22 years and in this profession for the last 32 years. I'm also a psychological counselor. I have 2 clinics in Bangalore, one in HSR layout and one in AECS layout. I'm often asked this question that how do we protect our elderly? Before I answer how do I protect, let us understand what is different with them. There are 3 big elements which differ in the elderly from somebody who's not yet there. First of all, their expulsive power is less. That's why if they form mucus in the chest, the mucus will find way to settle worse in them than in somebody else. Second thing is, because by that time the whole body immune system or the whole system itself has gotten into weakened status, so the immune production is also weakened. So what they require, the response time of their body to an immune booster is going to be a little longer than for somebody who's of a lesser age. And third, what I've seen is that they are already under a lot of medication because of variety of ailments, which makes them immune compromised in general. So now, once we understand this, then it becomes easy to manage what do we need to do. We know that they are going to be eating less. So what we can do for their diet is we split their diet over the day. Instead of giving them maybe 3 meals, we'll give them 6 small meals. And in each meal, it should be a simple meal, which is simple for them to digest. And in each meal, we think, like for example, breakfast needn't be everything put together, just one simple boiled egg. For those who do not like to have eggs, they can be given freshly made paneer at home, just a little serving over. Then at 11 o'clock, we give them a little fruits so that fruits are simpler and they infuse a lot of vitamin in them. Lunch can be simple dal chawal with a little more ghee in it so that they can digest and not be constipated. In the evening, when you give them the tea, then make sure that they eat something during that time. So elderly should be fed like babies. They should be given 6 small meals, each meal having some protein content, some fats, and definitely more fruits. That's number 1. Number 2, at the first hint of a cough in an elderly person, I would ask their caretakers to immediately make sure that they start taking passive steaming. You can just sit with the steamer and let them inhale it gently so that the chest keeps on fighting it out. And instead of pumping in too many cough syrups or anything, please boil some pepper in water and take that water, add a little ghee and feed your elderly people at home. It allows the cough to trickle down from the throat and it doesn't suffocate them. There are very beautiful medicines in homeopathy like antim tart, like kalibai, which allow the phlegm to release itself through the potty. They will engulf the phlegm and the phlegm will come out through the potty and they can be free from it. And definitely please enhance them, please encourage them to wear an undershirt so that they don't catch cold, because the fighting capacity is definitely compromised in the elderly. Otherwise, the elderly are very wise.